Alright, so we're going to do a quick one over the vessels of the legs, and then we'll stop and pick up with the heart next time. So looking at the arteries of the legs, this is going to be your anterior view or the front view, and this is that posterior view or the back view. And so above the common iliac, coming down, is going to be that descending aorta, and then it branches into your left and right common iliac. This iliac then splits into your internal iliac, so this is going to be delivering blood all inside of those ilia with the sacrum back, right? And the other half is going to be the external iliac, so coming out over here, and this is going to be the vessel that really gives the blood to the rest of the leg. Off of that external iliac, you're going to have a branch right here where you get this deep femoral and then your femoral artery. And so if you look at the femoral artery, it actually runs medial and then right down the midline of the leg, right? Femoral, this one is a pulse point. If you feel near the inguinal region, you can feel a pulse there, and that would be the femoral. And as you come down, you can see this genicular artery come off of the femoral, and then behind the knee is the popliteal. You can see it behind the kneecap right there running. So this is the popliteal. Again, if you remember those anatomical terms and the places that we have talked about, iliac is where you find the iliac, femoral is where you find the femoral, popliteal is where you find the popliteal. Then your popliteal runs down, and where you have your peroneal branch off, you get your posterior tibial. And on the other side, where that genicular comes off, you can see it kind of wraps back around and you get your anterior tibial. And that anterior tibial comes down to the dorsalis pedis, right there at the top of the foot. Dorsalis, talking about the back, pedis, talking about the foot. And this is also a pulse point. So if you put your fingers right there on top of your foot, you can feel a pulse. A lot of the times, this is where, if you're laying in a hospital bed, the doctor will come and you'll have your foot like this and just rest their hand on your foot while they're talking to you. And while they're doing that, they're taking your pulse, because it's a really non-invasive area to take a pulse versus, say, like the femoral up there in that inguinal region. That would be pretty nerve-wracking if someone took your pulse there. And again, this way they can do it non-invasively, and a lot of the times you don't know that they're even doing it, because there's a thing called white coat syndrome. When doctors and nurses are taking people's vitals, they see like an increase, so the blood pressure might be a little bit higher, the heart rate might be a little bit higher than it would be normally at resting, because when people are getting their vitals checked, they're a little nervous. And so dorsalis pedis is a great way to take somebody's pulse without freaking them out or letting them know that you're taking their pulse. So again, after the popliteal, you're going to have your peroneal branch off back here on the posterior side and going down the fibula. On our veins, all the blood from the leg and from that iliac sacral region all drains into the common iliac, and then that common iliac drains into the inferior vena cava. That common iliac, just like the common iliac in your arteries, has an external and internal. So the internal is draining all the blood from this area, while the external is taking all the blood from the leg and returning it back into the the circulation. And so here you can see the external on the anterior side, the external on the posterior side. That external, if you follow it down, you see it becomes the femoral right here as it exits out. So there's the head of the femur. And it's still femoral as it travels down. There's another major vein that comes off right here on either side of that femoral vein. And that one's the great saphenous. And you'll see that the great saphenous goes medially down the leg, while the femoral kind of continues down the midline of the leg. And again, behind the knee, you have your popliteal, draining the blood from down here on this lateral side and a little bit on the medial side, while or in the midline, while the great saphenous is doing it all from this medial area. You also have a small saphenous, so right before you have your femoral coming down, right before it turns into the popliteal, you have the small saphenous come down and around, similar to the peroneal that we saw in the arteries. And then again, running anterior to the tibia is your anterior tibial vein. And that's it. So super quick, vessels of the leg, and we're going to pick up with the circulation of the heart, because how can you have a heart attack when your heart's full of blood? Well, it needs its own circulation, which you may have already seen in lab. But we'll get to that, and then we'll also talk about the individual parts of the heart.